Hi everyone, and welcome to the second day and the second case of the series that we've started. All of you know the hashtag IOTD and MOTD, that is image of the day and MCQ of the day. So yes, I hope everyone has seen the previous video that was posted yesterday as well on Facebook as well as Telegram, and on your request the video description of each of these will be uploaded on YouTube. So this particular video here onwards every day will be uploaded on the YouTube channel. Okay, so the second image that we have under this image of the day series is the history that I gave to you was a neck swelling. So here we have a neck swelling on which we've done an FNAC followed by a biopsy, and you had to give your opinion. So let's split these images and look at them one by one. I hope all of you have a tentative diagnosis in mind after looking at this particular image, be it the FNAC or be it the biopsy, right? So let's see these images one by one. This is image number 1. So yes, this was the FNAC image that we had, and in this FNAC the most striking point was the giant cell, that is the multinucleated giant cell. It's very characteristic. Here you can see this cell if you want me to zoom in. It's a huge cell and it's got multiple nuclei inside it, so it's a multinucleated giant cell. What about the image shown below it? Here all that you notice are a lot of cells with elongated nuclei. The nuclei were not round and simple, they were elongated, or basically they were slipper shaped nuclei. And which is that particular cell which has an elongated slipper shaped nucleus in this setting where you're also seeing a giant cell? I hope everyone can correlate. This is an epithelioid cell. What's the way of identifying an epithelioid cell? This very slipper shaped nucleus. Now all that you have to do, guys, you have to put 2 and 2 together. What am I seeing? I'm seeing a multinucleated giant cell and I'm seeing slipper shaped nuclei, that is epithelioid cell. Obviously everyone started thinking of a granuloma. Now the same thing I told you, that if you see the question above, the FNAC findings everyone has interpreted. The second was the biopsy. So let us see the biopsy picture on higher power, and here it is. See, whatever you saw on fine needle aspiration cytology, that is FNAC, the same thing you're going to see on biopsy also. So the two things that you saw on FNAC was giant cell and epithelioid cell. The same thing over here. If I zoom in, can you appreciate this giant cell over here? Can you appreciate? So again, it's a huge cell with lots of nuclei inside it. And can you appreciate some slipper shaped nuclei which I've encircled out here? They are a little elongated, yes. So now look at this one over here as well. So now what are the two things that you see in this picture? You see the giant cells and you see the epithelioid cells. Along with that, right at the periphery over here, can you appreciate that there is all around, if you notice, there are blue color, very tiny dot blue color cells that you see out here. What are these? These are all the lymphocytes. All those blue color dots that you see, that's a lymphocytic collar. That is something that surrounds a particular granuloma. So what are the parts of a granuloma that you're seeing out here? So this is the actual, if I take out a lymph node of a patient, say TB, everyone knows in TB we see granuloma. So if you take out the lymph node of a patient with TB, this is all that you're going to see. You will be able to see these particular three things. That is what constitutes a granuloma. So you will see giant cells, you will see epithelioid cells, and you will see a lymphocytic collar. Let me show you another picture to make you more familiar with the same thing. See, this is another picture. Now here you will say that, ma'am, in the center I'm seeing this round pink structure. Yes, pink, it's more pinkish. And the periphery, like this part that I'm highlighting, at the periphery, this has all those blue color dots. Exactly, because this periphery is the lymphocytic collar. And this pink color structure in the center, if you zoom in, you will very well appreciate that you can see a lot of those slipper shaped elongated nuclei. The nuclei are long, slipper shaped over here. So yes, these are all the epithelioid cells. I hope it is clear to everyone. So here I'm not seeing a giant cell. So you should be able to pick up a granuloma even without a giant cell. You can see epithelioid cells, you can see surrounded by a lymphocytic collar. Now, one thing that is not shown in the image that I showed you, but can be seen is, what if this was actually a case of TB? What if this granuloma was actually that of tuberculosis granuloma? What else would you have seen? You would have seen caseous necrosis. So that's a gross image of a lymph node. Gross image of a lymph node. It's cut open, okay? So can everyone appreciate that the cut surface shows you that cheesy appearance which all of us know as the caseous necrosis? Yes. If I do an FNSE from caseous necrosis, what is it going to look like? So, well, it would have looked like this. It would have looked pink and granular. Can you appreciate? It's looking all, if you see the image very carefully, all this entire image out here, this particular image, can you see it looks all pinkish and little, it doesn't look homogeneous. It looks a little granular. It looks a little granular, as if some dirty material is there. Exactly what is necrosis? Necrosis is cell death, na? So it is all dirty granular material. So if you would have seen the gross showing you this caseous necrosis, then FNSE would have shown you this pink granular material. So now put everything together, guys. This was the image provided to you today. So what was the diagnosis for your IOTD of the day? It is granulomatous lymphadenitis. For your quick revision, here you can very well appreciate a giant cell. Here you could see those slipper-shaped epithelioid cells. So this was the finding that you saw on FNSE. On biopsy, you could again appreciate giant cells. You could see epithelioid cells. You could see the lymphocytic collar. So yes, this is a case of granulomatous lymphadenitis. Having discussed this, I hope it is clear with everyone. Let us move on to the next one. Now you know the other series. Everyone is well versed with the two series that we are conducting on a daily basis. Now we come to MCQ of the day. Okay, so now MCQ of the day, this was, why am I saying question 2? Because I'll keep all these questions and cases labeled so that, many days from now you can keep a track of the number of cases and the number of images that you've seen. Okay, so here we have, let's read the question together. Here we have a 14-year-old patient who underwent an intestinal biopsy. Okay, so there's a 14-year-old patient, intestinal biopsy, and that shows the following histopathological findings. So I've given you an image, and which of the following statements is incorrect about the condition? So they're asking you the incorrect statement. Option A, intussusceptions are common, autosomal dominant, gain of function of LKB1, and most commonly affected site is jejunum. So you have to get me the incorrect statement. Let's read about it. So first and foremost, the catch point over here was this image. If I zoom into this image, what do you notice? I'll zoom in as much as I can. Can you appreciate? See, it's an intestinal biopsy, so it's been taken from the intestine. Can you all appreciate some round glands? Yes, the epithelial round glands. And who is coming in between these glands? What is this pinkish structure that is going? Do you see? It's trying to split these glands like the branches of a tree. Like the branches of a tree go in between. So they are going in between. You know what this is? This is an arborising polyp. So see it without the labelings, because that is how you'll get it in the exam. This is the arborising pattern that you notice. You know what a simpler image would have been? Let me read out, or let me teach you about it, and then I'll come back to these questions. So this would have been a very characteristic polyp if they would have given you a characteristic photo. So this is the one that you have to know. See, it looks like a tree. It looks like a tree, as the name suggests. Arborising polyp. It's a type of a hamartomatous polyp. And you know how you'll pick it up? See it anyway. This one is very characteristic because it looks like the tree. But if you zoom in, you will see that, can you see this muscle? Can you see, if I trace it, this muscle is going in between and splitting the glands. So this muscle is sending out these branches of a tree, and that is the meaning of an arborising polyp. Some people also like to call it the Christmas tree polyp. It is sometimes also referred to as the Christmas tree polyp. Yes, so you have to know this as well, arborising or Christmas tree polyp. Let us see more images. Along with this image, how would the patient present clinically? Please remember, the patient shows pigmentation. So like you can see over here, cutaneous and oral pigmentation. So you can very well appreciate mucosal and cutaneous pigmentation. So when you get these two things together, number one, you've got pigmentation. Number two, you've got a polyp. See, you've got a polypoidal like structure, and that polypoidal like structure is looking like a Christmas tree or arborizing polyp. What are you dealing with? It's Peutz-Jeghers syndrome. It's Peutz-Jeghers. So some very salient features which will help you, I've tried to enlist over here. The way you say Peutz-Jeghers, P and J, right? So please remember, P is for pigmentation. That is how we'll remember it. Okay, P is for the pigmentation, J is for the jejunum, because that's the most common site. Where will you see polyps most commonly? You will see them in the jejunum. So P for pigmentation, J for jejunum. And the next mnemonic is everything is to do with 11. If someone asks you what is the median age of presentation, it is 11 years. If someone asks you which gene is mutated, it is STK11, okay, serine threonine kinase, STK, serine threonine kinase 11, or LKB1. But please remember, loss of function. You know, if you read your options correctly or very carefully, the option said gain of function, and that was the incorrect statement. It is loss of function. So let me tell you, so you have P for pigmentation, J for jejunum. In the jejunum you see arborizing polyps. Then median age is 11 years, gene is STK11 or LKB1. Please remember that these polyps can very commonly cause intussusception. You know, one of the very common complications of these patients is intussusception, number one. And please remember, the inheritance that this disease follows is autosomal dominant. It follows an autosomal dominant inheritance. So I hope everyone is crystal clear with this Peutz-Jeghers, exactly what was given in the question. How will you pick up an arborizing polyp? You will pick it up by the muscle going in between the glands, like the branches of a tree. So let us read the options. You had to find the incorrect statement. Option A, intussusceptions are common. Yes. Option B, autosomal dominant. Very true. Option C, gain of function of LKB1. No, it was loss of function of LKB1, and that's your answer over here. Option D, most commonly affected site is jejunum. Well, yes, that is what we just studied. So guys, this was the MCQ of the day. I hope everyone got it right. It was not a very difficult one, but I wanted you to get familiar with the arborizing polyp, hamartomatous polyp. And your homework for the day is that you're going to open up Robbins or your notes and read all the hamartomatous polyps, that table, which is very, very important for the exam. So yes, every day a small homework probably would also help you open your books more often and also revise your topics alongside. So that was it for today. Thank you for listening, and since many of you keep asking me where to follow the lectures, so that's a quick summary of where. And also for all the Instagram active people, so finally, by my name, that is the same name, Pathology by Dr. Preeti Sharma, I have also started an Instagram handle. So you know, all the people who are active on Insta, yes, I will be posting these videos and these questions on Insta as well by the same name. So yes, whichever platform you guys are comfortable on, you can follow me and keep track of all these updates. Thank you so much for listening. Tomorrow same time we'll meet with another image and another MCQ. So don't forget to do your homework. Thanks for listening.